The reason why I started ALC is I was 32 and my dad died. And after dad passing, I had this passion about how people were treated. Just the lack of bedside manner. I think clinically they were always good clinicians, but to have a sound body next to someone who's on, home health or hospice and being almost rude and condescending because they're not at your education level or they didn't have the compassion or the empathy, they were kind of callous for being in the market so long. And I said to my mom after dad passed, I said, I'm gonna go open one of these companies. And being able to take care of my dad in the last 11 months of his life, being the nighttime caregiver, really taught me something about who I was as a person and allowed me to really understand of what my next part of my life would look like. And usually it takes about 12 months to get a home health care license. I think it took me about 18 because I probably made every mistake known to man because I didn't know enough. And it was kind of a difficult journey for me because, someone said, it'll cost you, say, $10 to open this place. Well, I spent that times 5. I spent all my money. I was like, oh my God, what did I do to myself? In year 2, we just started trickling and getting busier. And year 3, it got better and better. We brought on an amazing staff in year 3. It was a great journey. Year 4, we fell into a private duty opportunity. So home health was kind of like an incubator, for lack of a better word. And we were able to grow that. And then having our private duty business was almost like a lost leader where it would help us feed business into our home healthcare business. So we said, yeah, we're going to try it. So we fell into this opportunity. I was able to say, hey, let's try it. We tried it, and it really grew. It grew faster than home health did at the time. And we were at 150 patients under care in no time. Home health has been in business 3 years, was just getting to 150 patients. So it was kind of exciting. About year 8, year 9, I'm in downtown Naperville having lunch with a couple doctors, and I walk out and I run into a family that was, one of our first home health care families. And their husband wasn't very happy. He's like, I'm truly disappointed with you. He had some choice words. And I said, what's wrong? What did I do? He goes, you gave my wife to that horrific hospice company. I said, what can I do to fix that? He's like, Tony, go open a hospice like you run your home health. So came back to the office, and my team now has been with me probably most of them 8 years. I'm on home health side, and they were all getting excited. I said, hey guys, what do you know about hospice? And they yelled at me to get out of the office. Because we were actually at 300-400 patients at the time on home health and was growing really nicely. And it was rough getting hospice going. Finding the right people was more challenging than I thought. Thinking in the past of having how many people we've gone through in hospice team, we've probably went through double the amount of people in the hospice team than we had done in home health. And why? Because finding the right person is not easy. The empathy is not real in everybody's personality. They interview great and they look great, but at the end of the day, they're not the people who they are when they interview. And not to say they're bad people, just not what our culture was looking for. And we've been very good at putting people first and making that a culture that we can live with. Do we make a little bit less as a corporation? Yes, we do.